Let's talk about the new nominee to be Surgeon General of the United States. There was a contentious confirmation hearing held on the Hill yesterday. And I want to bring in someone to talk about it. Dr. Frita is a triple board certified nephrologist and the medical expert in internal medicine, pediatrics, and obesity medicine. Also, she has a very popular and very informative show live stream on YouTube. Her channel is the Dr. Frita Show every Monday at noon Eastern Time. So thank you for joining us. Can we talk about Casey Means? Because Casey Means is being nominated by the Trump administration to become the Surgeon General of the United States, but she's actually not, much like Robert Kennedy. He didn't even go to medical school, at least she did, but she's not a licensed practicing physician.
She is not. She did not complete her residency. She is not currently licensed. She does not seem to have much clinical experience. She is a wellness influencer who has talked about some anti-vaccine rhetoric. She supported RFK Jr. She was sidestepping questions in that hearing. And quite frankly, she doesn't seem to be qualified by any stretch to be the U.S. Surgeon General.
I think it's important that you mention that she is a wellness influencer because that's where she has made her money, her bones. She's come to fame about that. Recently appearing on the Joe Rogan show with some very controversial statements regarding estrogen and testosterone, et cetera. I want to play that and then we're going to get to the hearing. Here she is on Joe Rogan.
We've got a huge percentage of American women on birth control pills. That's, of course, hopefully post-puberty. But we're putting women on exogenous estrogens for acne, for PCOS, for menstrual irregularity, sometimes, of course, for actual birth control. But it's like it's very ubiquitous now in the environment. And it's like when you kind of know this stuff, you're like, how are we allowing this to happen? And then, of course, it's affecting boys, too, right? And so I kind of just think about this world we're living in where it's tons of estrogens. It's not like there's a bunch of exogenous testosterones, right?
What is she talking about?
She doesn't know, neither do I. It frustrates me so much, especially since this administration is supposed to be all about meritocracy. But when you listen to her, clearly she's not an OBGYN, she's not an endocrinologist, and what she is saying is not based in any type of evidence. We study birth control pills, we study hormone replacement therapy. Yes, all medicines have, certain benefits, certain side effects, certain risks. However, it sounds like what she's implying is that by us having all of these estrogens, we're somehow ruining the lives of women, which then would make you think, well, should people not be on birth control? Should they not be on hormone replacement therapy? And she has no evidence. See, that's the key. When you are a board certified physician, when you have a medical license, you realize you can't just go around stating opinions because that's dangerous. People listen to you and then they might disregard what their actual physicians say.
Well, that's a problem with Robert Kennedy and his whole thing about vaccines as well. And the question from Bill Cassidy, who asked her, who is a physician himself, he is wondering, he is concerned about vaccines, people, having misinformation about it or spreading misinformation. And this is during the hearing, they had a back and forth about would she recommend vaccines, just flu vaccines for children. Here it is.
Question. We've had 2 children die from measles in West Texas. We now have an outbreak of like 1,000 children almost in South Carolina area. You're a mom. We're on the verge of losing our measles elimination status. Would you encourage other mothers to have their children vaccinated against measles with the MMR vaccine?
Like you, I'm a physician. I believe vaccines save lives. I believe that vaccines are a key part of any infectious disease public health strategy. And I would work with you, the CDC, the NIH, ACIP,
but would you
FDA.
Encourage mothers to vaccinate their children with the MMR vaccine, seeing how we've had children die and this outbreak in South Carolina?
I'm supportive of vaccination. I do believe that each patient, mother, parent needs to have a conversation with their pediatrician about any medication they're putting in their body or their children's bodies.
You're the nation's doctor. Would you encourage her to have her child vaccinated?
I'm not an individual's doctor, and every individual needs to talk to their doctor before putting a medication in their body. I absolutely am supportive of of the measles vaccine. And I do believe vaccines save lives and are an important part of the public health strategy.
We've had a tough flu season this year. Would you, as past Surgeon Generals have, encourage Americans to get vaccinated with the flu vaccine?
At the risk of sounding repetitive, I do think it's very important as a physician and to rebuild trust in public health to make sure that patients are encouraged to have informed consent with their doctor before getting any medication. I believe vaccines save lives. I believe they're an important part of public health. I also do not want to not encourage patients to have a conversation with their doctor. I think it's incredibly important, and informed consent is going to be part of building trust in public health.
The thing for me is that he asked her if she would recommend. You can have a conversation, an informed conversation with your doctor and say, do you, now knowing all of that, doctor, do you recommend? And so she could answer that question, but you seem very frustrated by her answer. Why is that?
I want to jump through the screen because no matter what, we always get informed consent. I have 3 children, and we always have to have the conversation, benefits, risks of vaccines, and you sign. Informed consent is there. She knows that. What he was asking her if she will encourage it. So I'm a doctor. I'm not a mechanic. If I go to get my car fixed, I don't want to sit there and have a conversation as if we're on the same level. I need the mechanic who's had the knowledge to encourage me to do what's best for my car. And that's the position we're in as physicians. By her not answering that question, we can go ahead and assume the answer that she will likely be in alignment with RFK Jr. and not encourage. And we saw that he changed the whole vaccination schedule and he stopped recommending vaccines, as was mentioned by Bill Cassidy, who I have a problem with because he's a physician and he knows better. He's a liver doctor. He voted to confirm RFK Jr. And then after they changed the hepatitis B vaccination recommendation, then he goes back and makes a plea. After Louisiana started having the outbreak in pertussis, whooping cough, then he goes back to RFK Jr. and says, so he knows better, just like Dr. Oz. So I have a certain frustration with them. As for her, she didn't answer the question. When truth be told, just as the physicians in the American Academy of Pediatrics and all the other reputable organizations do, we need to stick with the vaccine schedule because we know that vaccines are safe, they save lives, and we don't have to guess. We didn't have these measles outbreaks. Last year, we had the highest number of measles cases than we had in 30 years. We had children to pass away from the measles. Flu, super flu, out of control. So she's already letting us know that she's not going to be an evidence-based physician if this indeed is an indication of how she would be as Surgeon General.
I'm glad you mentioned Dr. Oz because this is very similar. Remember, before he was still on television for the Dr. Oz show, and he had to face the music for the Senate or the House subcommittee on recommending what they call, things that didn't work, snake oil, basically being a snake oil salesman. And that's kind of the vibe that I'm getting from this woman because she is also an influencer. And as we showed her talking on Joe Rogan, she was questioned about it at this hearing, as a matter of fact, from Chris Murphy, who skewers her for hawking products and making money off of them and not disclosing it. Here it is.
Are you familiar with FTC policy that requires those who are recommending products online to disclose their financial connection to those companies? You routinely violated this policy, and that in fact, in the majority of your posts for many of the products you recommend, you did not transparently reveal your financial connection. Function Health, which is your lab testing platform, data shows that you disclosed your partnership with them less than a third of the time that you recommended their services online. Genova Diagnostics, you disclosed your sponsorship in only 2 of the 9 times that you promoted Genova. Daily Harvest, you disclosed your sponsorship in only 3 of the 14 posts recommending that product. Zen Basil Seeds, you disclosed your partnership only 2 out of the 13 times that you recommended the product. This seems systemic. It seems that in the majority of instances in which you were, as a medical professional, recommending a product, you were hiding the fact that you had a financial partnership. You seem to be in regular willful violation of the FTC rules. That is concerning as someone who agrees with Senator Cassidy that our focus has to be on restoring trust in the medical profession. And yet, over and over again, you seem to be at scale recommending products without telling your followers.
Now, do you know doctors that hawk products?
Well, there may be some, for the most part. Any physicians with whom I'm associated, if they're promoting a product, then there's going to be some type of an evidence to support it.
Disclosure, and they would disclose, right?
And
Right.
disclosure. Yeah, because there's certain things, some products that might help, won't hurt, and you have to share. Okay, this is not FDA approved, or you have to just be open about it. But when you start getting these wellness influencers and a lot of people who aren't physicians who are out here pushing supplements, you'll find that they're pushing, just as an example, certain supplements that have turmeric in them and who knows how many preservatives, when honestly, patients can just go and get the whole root of the turmeric. They'll push, different beet pills or beet, powder, which could potentially be fine. But honestly, people can go buy a beet that's cheap and can actually help. So in her circumstance, by her not disclosing, I don't find it to be an accident with all the times that he shared. It lets you know already that she, I guess, in alignment with the current administration, plans to deceive the public, which can be quite dangerous for someone who wants to be Surgeon General.
What's your concern about this as a doctor, seeing patients all the time? I'm sure you see people, especially with the resurgence of measles and all of that after these vaccines have not been recommended by this current administration. What's your concern about this particular person?
My concern is that she will continue to spread misinformation, just like RFK Jr. He, to this day, is a vaccine skeptic. He twists himself in knots about the measles vaccine, but he still implies that measles are associated with autism or cause autism when that's been debunked. She, even in this hearing, suggested that there's more research needed when we've had decades and decades of research. We know that the measles vaccine is safe. We're already seeing what's happening. We've had children to die. I'm afraid that the misinformation, disinformation will continue. And just as sure as we have an administration that's no longer recommending life-saving vaccines, people who are in low-income neighborhoods, people who don't have transportation to their doctors, people who don't have the time or the copay to do all this extra conversation, they are going to be left unvaccinated, and people who are immunocompromised will pass away. I'm very scared that she's going to clearly make America sick again, just like RFK Jr. And also, they need to not ever tell me anything about merit again. And they certainly don't need to mention DEI in a negative connotation, because she, just like RFK Jr., is wholly unqualified for this position. And it's a shame.
Think about this, Dr. Frita. We have Dr. Oz, we have RFK Jr., and then we may have Casey Means. Yeah, that's
I will cry.
That's the state of our union right now. Dr. Frita, a triple board certified nephrologist and a medical expert in internal medicine, pediatrics, and obesity medicine. Also, check out her live stream on her YouTube channel every Monday at noon Eastern time.
It's Heart Disease Awareness Month. I've heard you talking about it on your show. And yesterday I did an American Heart special where I had Bravo's Married to Medicine's Dr. Contessa. I had Cardi B's dentist there, Dr. Catrice Austin. And we talked about all things heart, including how your gums not being healthy can affect the heart. And so I would love it if people can go check that out on my Dr. Frita channel as a replay, just, in celebration of American Heart Month and heart disease awareness.
Will do. I'm going to check it out. Thank you very much. And you're right about the gums. Floss, everybody. Thank you. Thanks, Doctor. Thanks so much for watching, everybody. Your support means the world to us. Don't forget to hit that like button and subscribe so you never miss a show. We're live every weekday at 10 a.m. and 5 p.m. Eastern Time with new clips dropping at 2 p. and 8 p. And if you want even more Don Lemon Show content, join the Lemon community. Members get exclusive posts, behind-the-scenes videos, and live chats just for you. So hit the join button or visit our channel page to sign up. Thanks again for all your love and your support, and I'll see you next time.